to be quite honest, Medicare's been bankrupt for a long time. I think it runs out of money completely in like 2030. So it's to the point where it's essentially bankrupt. So they have no interest in increasing prices. They have no interest in basically paying you more because they don't have enough money to pay their own bills. If you are part of the mainstream medical system, the important thing to realize here is that your pay is fixed and that if anything, is going to go lower. All right, guys, welcome back to the Medical Entrepreneur Podcast. My name is Dr. Adam Sewell, and we are here because we are on a mission. We have one vision, one purpose, which is freedom through prosperity. Today, we're going to talk about what medical professionals need to know today. If you're part of the mainstream medical system, you are in danger right now. And what I mean by that is that you need to understand how mainstream medicine works, how the business of medicine works. And once you understand how the business of medicine works, then you'll understand what's going on. A couple things to understand. One is that the entire system of mainstream medicine operates on a series of codes. You might be familiar with CPT codes and diagnosis codes like ICD-9, ICD-10, CPT codes for procedures. All of these codes like this are developed by the American Medical Association, who then licenses it to the federal government or Medicare to basically use in their practice. Medicare then sets a price for all of those codes and says, hey, this is what is the standard price. And depending on the contractor throughout the country with Medicare, they set a certain price depending on hey, if you're in San Francisco, it's going to be more expensive than if you're in the middle of nowhere, Kansas. However, these variations are not that large, but they are a little bit. But basically, the prices are essentially fixed. So the federal government actually determines how much pay is going to be allowed for each procedure that is done. And private insurances like Blue Cross Blue Shield, Aetna, United Healthcare, Humana, all of these kind of guys, what they do is they basically go off of that reimbursement and they offer a percentage of that. In the past, companies like Blue Cross Blue Shield used to offer 110 to 130% of your Medicare rate. Nowadays, companies like United Healthcare may offer you the same rate as Medicare, or may offer you less. It's now getting to be common where you see that you're actually getting paid less by private insurances than you are by Medicare, which is sad to say, because they were the cheapest for a long time. And part of the reason why they were cheapest was because Medicare system had consistently cut reimbursement over and over and over the last 20 years. In fact, if you look at reimbursement for almost any procedure, no matter the complexity of it, no matter the danger of it, it has been cut essentially to almost nothing. For example, did you know if you want to do a heart bypass, you want to do a coronary artery bypass graft, you want to basically cut someone's chest open, rip open their chest, take veins from their leg and basically graft them into their heart, stop their heart, put them on a pump, graft them for the heart, then restart it, then sew them up, do all the stuff that's required for open heart surgery. The professional fee for that is roughly around $1,000 for doing that surgery. I want you to think about that. All that danger, all the risk of finding the patient, talking to them, doing all the research on their history, understanding if they're a good candidate or bad candidate, reading their imaging studies to understand where the coronary artery blocks are, then taking to the operating room, prepping them, opening their chest surgically, stopping the bleeding from that, doing the actual surgical procedure. All of that pays $1,000. Makes no sense, right? And so this is what's happening, but it's starting to accelerate because of inflation. So the bottom line here is that if you're part of the mainstream medical system, your pay is fixed by the government. The system already is socialist. The federal government is the one who sets the prices for Medicare reimbursement, and everybody goes off of that. So by definition, the federal government is setting the price that you get reimbursed. They're telling you what you're worth. And to be quite honest, Medicare has been bankrupt for a long time. I think it runs out of money completely in 2030. So it's to the point where it's essentially bankrupt. So they have no interest in increasing prices. They have no interest in basically paying you more because they don't have enough money to pay their own bills, So if anything, if you are part of the mainstream medical system, the important thing to realize here is that your pay is fixed and that if anything, is going to go lower. And so here's what is going on. There's only so many people that you can see in a day. There's only so many patients that you can treat. There's a hard limit to this, right? The documentation requirements for patients have increased significantly in the last 5 years. The amount of insurance requests, the amount of insurances coming back and saying, hey, you didn't write this one thing down, so we're not going to pay you, that kind of stuff has increased significantly over the last few years. And the other thing that's happened is that since COVID started, the government did something that had never happened before. As you can see here, there's a graph of all the money printed throughout the history of the United States. you will see that in the year 2020, 21% of all US dollars that have ever existed were printed in that 1 year. Just think about that. Like it's 1/5 of the money supply, roughly, has been basically printed in 2020. That's how much money they printed. It is just astronomical, the amount of money they printed. Of course, this immediately led to heavy inflation. You can see here, there's some headlines of inflationary inflation. And this is why you start to see the prices of everything go up. This is why you see the price of oil going up. You see the price of food going up. You see the price of chemicals going up. You see your medical supply going up. You see your malpractice going up. The price of everything is increasing because the reality is that when the government prints a lot of money, it devalues the dollar. So the value of the dollar is actually going lower. So even if you get paid the same, the actual purchasing power of that dollar is not as much. Here's a graph showing all the inflation that is calculated by the government. The government is currently calculating the inflation rate, I think, at like 8.2%. In January, they calculated it at 7.5. So even by their own measures, the inflation is very high. The reality, though, is that the way they calculate inflation doesn't include majority of the products that people use. In fact, the way they calculate inflation doesn't include fuel price, home prices. Many of the common things that everybody has to buy every day to live are not calculated in that. And there's a reason why they did that, because they want to suppress the true amount of inflation that's going on. However, there's a guy named John Williams who runs a website called shadowstats.com. And what he does is he actually takes the inflation data and actually calculates it the way it was done in the 1980s and the way it was done in the 1990s. In the 1980s, if we look at the amount of inflation that's been going on, if we calculate it according to that rate, the way they used to calculate back in the 1980s, we would have 16% inflation per year. And I think that's pretty accurate. That's what you see in your prices. That's what you're seeing in society. You see in your medical supplies. The stuff is not getting cheaper. If anything, it's getting way more expensive, right? And so for the last 2 years, you've had roughly about 16% inflation. As inflation occurs, your money becomes worth less and less. And so even if you earn the same amount of money, your buying power is decreasing. Here's an image of some people from Zimbabwe, the starving billionaire. They have over $1 billion there on this board. And yet, even though they have all that money, they can't buy anything. Here is a lady here with a handful of $10 trillion bills in Zimbabwe, and it is basically worthless. At the time that this was taken, 175 quadrillion Zimbabwe dollars are worth roughly about $5 US. They're essentially worthless, and that's why you see this guy grabbing all this money to maybe buy a loaf of bread. And that's what happens when you have hyperinflation. So just to recap, if your compensation is connected to the reimbursement system of the mainstream medical system, meaning you're connected to private insurance, you're connected to Medicare, you're connected to Medicaid, your compensation has already been decreased. You just didn't realize it. Over the last 2 years, you've had 15% inflation roughly per year in real numbers, which is roughly you've received a 30% pay cut. And that's why when I talk to a lot of my colleagues that still take, Medicare and private insurance, they're just kind of bewildered because they're working harder and harder, but they're getting less and less every year. And they don't understand, like, why is that the case? I don't understand. I'm seeing more patients, like we have more staff, we have more overhead, we have, all the costs of everything is going up. But even though we're seeing more people, at the end of the day, when I get done, I have so much less than I did previously. And the reason why is because you secretly have had your pay cut and they just didn't tell you. The government is continuing to print large sums of money. They're continuing to spend vast sums of money. You can just take a look at any of the things going on. They're basically consistently having more and more spending bills every year. And so we're estimating that the inflation rate currently at the low end is roughly about 8%, at the high end around 16%. And we think it's going to continue some more. The reality is that your pay is fixed and the value of your pay will be decreasing. So if you have your own practice, you can definitely feel this every day. You can see that the cost of your labor, the cost of your employees is increasing, right? They want more money per hour. Why? Because it costs more to live. The cost of their food has increased. The cost of their rent has increased. The cost of them driving has increased. The cost of their fuel has increased. The cost of their car has increased. The cost of their clothing has increased. All of these things have increased. And so they need more money. Well, you got to pay more money for them, right? Otherwise, they're going to get a different job. Well, also the cost of your medical supplies have increased. The cost of your malpractice insurance has increased. But what has not increased is the cost of is the amount of your reimbursement. So if you work for someone, though, if you work for a hospital, you may not feel this directly, but you can see it indirectly. You can see it, all the new efficiency guidelines they have, all the new metrics they use to track you. You can ask anyone who does any kind of surgical procedures that work for a hospital. They're tracked religiously and usually paid by a thing called RVU, or relative value units. And so if you look at your relative value units, you'll see that they're not paying as much as they used to in the past. And you definitely haven't had a 15% increase in your RVUs in the last 2 years. If you were the same place you were 2 years ago, to be in the same place financially, your RVUs should have increased by 30%. I don't know anyone who works for a hospital that got an increase of 30% in RVU value. If you're working for someone else, you can see there's more and more demand to do more procedures, to see more patients faster, to have more turnouts, to have more throughput, to have more surgeries. And the reason why is because the actual value of the reimbursement is decreasing. So the systems are trying to ramp that up to maintain themselves. So now is the time for you to break away and become a medical entrepreneur. Now is the time for you to develop that additional stream of income. Now is the time for you to basically say, hey, look, I see that this thing is going in the toilet. I see that this medical system is falling apart. I need to make sure that I can use my skills to basically have my own thing, to have my own business, to have my own medical enterprise. So you need to basically be able to get to a practice where you can deliver your services and be able to set your price. As long as you're in the mainstream medical system, you cannot set your price. The federal government and Medicare in particular set your price, and other insurances base your reimbursement off of that set price. You need to be able to collect cash. You need to be able to set your own price. And there's a lot of ways that medical entrepreneurs do this. Here's just a few. People go into aesthetics. Aesthetics is an easy add-on for most people in their practice. If you're a family practice, I would say if your majority of practices, OB-GYN, family practice, whatever, adding aesthetics to your practice is a no-brainer. It's very simple and it's all cash-based, and you already have the patient demands. You already have the patient population, and it's very simple to do. You can add functional medicine. You can add alternative medicine. You can open a ketamine clinic. You can do legal consulting. You can do regenerative medicine practice. You can also have just a cash-based procedure practice. I know an orthopedic surgeon who just got so fed up with all the paperwork and the decreasing reimbursements. He does exactly the same thing he did before, just only to a fewer amount of patients, and he charges cash at a higher price. And so he has less patients that are worth more. He actually works less hours, but makes more money than he did before because he only takes cash, and he doesn't have to have a whole team to deal with insurance. He doesn't have to have a front desk staff of 3 to 5 people to get on the phone with insurance to see if the insurance is active. And if it's not, what happens? He doesn't have to have a billing team of 3 to 5 people doing all the billing and following up on claims that are automatically denied because insurance is denied 10% of the claims that come to the door anyway, no matter what. This kind of stuff. Get to a cash-based practice as soon as you can. You can also do an IV infusion clinic, and you can even do a cannabis clinic where that's applicable. So to get more information about becoming a medical entrepreneur, please go to medicalentrepreneur.org. We have a challenge there that will help get you set up and get your practice up and running to get your medical entrepreneur business started so that you can escape the mainstream medical system, you can set your own prices, and you can be the captain of your own ship, and you can be in control of your own destiny. One vision, one purpose, freedom through prosperity. Thank you, medical entrepreneurs, and we'll be seeing you again in the future.